And that there's some prep work you do between getting out of exposure and starting the binders. And I think we're really interested in hearing more about that.
Yeah, look, actually, some you guys have mentioned a couple of these things on previous podcast episodes. So I'll just walk you through. It's basically it's something that people can do while they're trying to get out of exposure too. So I like it because people feel like they're doing something while they're kind of sorting out their home or work situation, which is often when you feel most, vulnerable and like you can't, you're not in control of anything, right? So doing something I think is helpful. And some of these things I should also mention, Dr. Shoemaker does talk about them, but usually as a only as a result of or in response to a problem with tolerance to binders to the cholestyramine. And I more use them in
Proactively.
preparation for the binders. Yes. So I'd rather kind of prevent a reaction than wait for the reaction and see and then use it, if that makes sense. I think it's
Sure.
also just because I'm a health coach and nutritionist. So I find these things really helpful just in general health and wellness too, right? So diet is obviously a big one. I know you guys have spoken about the carnivore diet many times, and I don't always guide people to the carnivore specifically, but anything that's kind of whole foods, low carb, higher fat, higher protein is where we want to go. And I think everybody's different. Some people do so well on the carnivore diet, some people don't do so well, and they do better on a keto diet or maybe a low carb paleo diet or something like that. So, but some people have such significant resolution of symptoms just from changing their diet. And obviously, that's not necessarily changing, some of these CIRS markers, but from the perspective of symptom resolution, it's pretty amazing, right? Where just this seemingly simple change. And so that would be the first thing I would do. And in there, I would probably include the lipid replacement therapy as well, because I am often trying to push lipids in the diet as well. And then we may, fish oil or cod liver oil or something like that would be probably the first supplement that I would put people on. I know you guys have spoken about that and your success with that as well.
Yeah.
I find that to be fabulous in many different ways as an anti inflammatory, as an immune modulator, all of those things. Lifestyle is another one. So the obvious things like sleep hygiene and making sure people are moving if they can tolerate any kind of movement, just to get that lymph moving, all of that stuff, right? The stagnation of sitting and not doing anything is just kind of compounding the issue with the toxins. Hydration is super important. CIRS patients are typically super dehydrated, even if they're drinking a lot of water. They just pee it out. And so,
Yep.
but at least making sure you're getting enough hydration is important. And then the nervous system component of it too, or, some people might call it stress management. I think it really depends on, there's a big spectrum here with CIRS patients of how much of this you need. Again, I know you guys have spoken about brain retraining in previous episodes. I think when people have been sick for a long time and had lots of kind of trauma around mold, the brain retraining programs are fabulous. And I've done them myself, when I was personally going through it, and found them to be very helpful. Some people, I think, just need more, techniques to help with calming the nervous system, breath work, meditation, tapping, whatever it is. I'm a big fan of the Wim Hof method, which also kind of gets toxins moving because of that, the temperature changes. Then I would move to gut health. So, gut health being, I guess, two-pronged. One of the reasons is that it's just pivotal to overall health, but the other part of it is that it's pivotal to detox, right? And we're really trying to get to the point where we can optimize detox. And so working on, dysbiosis, which is very common, leaky gut, which is almost 100% of people with mold exposure, insufficient stomach acid, insufficient pancreatic enzymes. So you're not actually utilizing all of those amazing nutrients from the food that you're eating. Gut motility, super important for detox, right? When you're backed up, there's no toxins moving, and worst case, you're reabsorbing those toxins, which is really not what your poor liver needs, extra toxins. And then the detox pathways, which some people would include that, I guess, alongside the binders, but I find it to be more helpful pre-binders. So just supporting that poor liver that's really bearing the brunt of this with food. I mean, I think sometimes we forget about food and how many foods are actually liver supportive and bile supportive as well, helping with the bile flow. That's one that I think is often missed. Is getting in those bitter herbs and those bitter foods, and also doing things like coffee enemas. I mean, you need to be careful at the start. I wouldn't suggest people at the start of their journey necessarily do coffee enemas, because they do dump a whole lot of toxin in the GI, and that can actually be too much for the liver at the start. So I typically would do that kind of more towards the end, when someone's a bit more resilient and has already gotten rid of a bit of toxin from their system. But yeah, so they're kind of the steps that I would typically use prior to binders. One, because I think then the binders are better tolerated. But two, the person is just, I don't know, I feel like they get back a little bit of their resilience by doing those few prep steps, which probably contributes to that improved tolerance to binders.
Yeah.